This is Tina Presents Creative Conjecture, and we're in conversation with Amir today. This podcast is a space to explore the shapes and edges of creativity, not with strict rules, but curiosity.
Hi, Amal.
Hi, how are you?
I'm good. How are you?
I'm doing well. Thank you for having me on today.
We're honored to have you on this show. Um, okay, so Amal, I'd begin by asking you that
Sure.
what does creativity mean to you at a personal level?
At a personal level in my day-to-day life, I like to think of myself as a creative person, but creativity isn't to me is not in just arts, it's in like everyday thinking, everyday design, day-to-day activities. It can be found in various ways as simple as for me, creativity is a way to like finding new ways to improve things as well, not just aesthetically, but systematically.
Interesting. Interesting. Can you give us some examples?
Sure. So, you know, I always I'm always thinking like, "Oh, how can I make things go quicker? How can I make things go smoother?" So, I think one of the biggest examples I have is simply like knowing how to like clean up my room, right? Like, how can I do this systematically while being creative? So for me, that included creating like organizational methods that work for me, like keeping all my I'm just a girl, so all of my skincare in one area, my makeup in one area, but just having a methodology that works for me. It doesn't work for everybody else, but that creativity behind it is like my mindset. So that's what I like to think of it like in my day-to-day life.
Cool, cool. And would you like to share with us any work-related examples, perhaps?
Sure. So my experience, I'm still kind of a newbie in the world, but I am part of a large healthcare system in southeastern Michigan. So we have a large hospital system that's also affiliated with a major university. So my role specifically is process improvement and project management. Um, so what that means is I'm responsible for a lot of projects that have to do with how can we keep improving. Of course, with any big system, you're going to always have new developments, new ideas. So I'm not really sitting in marketing. I'm not really sitting in IT, but I'm really working day to day with the doctors, the nurses, the managers of specific specialties, let it be or otolaryngology, let it be neurology, etc., to work with them to it can be as simple as coming up with ways to better manage how they store their linens in the room, or it could be big projects like, oh, we really want to work on reducing our wait times in the clinic. So my role is expansive. I can go anywhere, but I'd love to talk about some specific examples today.
Okay, okay.
um,
With the examples that you've given, for example, the first example you gave us about being creative was being creative with how to clean your room. And the second
yes.
example you gave us was, about improving the healthcare system. So, uh, do you agree that creativity is subjective?
I definitely agree. And I see that in my day-to-day life, not just at, my personal life, but at work too, because even with my coworkers, we will all have the same problem, right? But our approach may be different. So it's very interesting to share our perspectives and how we might solve a problem trying to get to the same solution.
Okay, and do you sometimes feel that in the real world we tend to get a bit judgmental when it comes to accepting other people's idea of how creativity can be or how it should be?
No, so my experience with creativity in my work, it first I will say it, I'm a bit of a newbie in the workforce, right? So when I'm entering into these conversations with managers who've been in positions for 20, 30 years of their career, they're the ones working directly in the clinic. It's always a hard conversation to have first with them that I am here to change something. It's always, very scary. um but I try to welcome in their perspective, of course, because I don't have the perspective of being a clinician in the clinic, right? I am someone who's behind the scenes, but I really want but a lot of the reason why I'm there is because they have that firsthand knowledge of how things are working in the clinic. I'm able to provide the design aspect or the creativity of knowing how to have design sessions or the creativity of knowing who to talk to and what to ask for, because sometimes they may be seeking the same, of course, solution as me. Like, we all want to reduce how much waste we have in the clinic with how much time is being wasted, but the proposal for them is way different what I would propose, because of course I'm coming to them with, here, we could do this idea of doing this, a daily huddle to reduce any miscommunications in the clinic, whereas they're not thinking that far, because they're really thinking, oh, we don't have time for that. But we're like, we have to make time for that. So creativity for me, it's like, it's not really like, oh, it needs to be some crazy idea. It could just be simple changes you're making in life that you had to think of.
I agree. I agree. But what I'm trying to understand is that, do you ever face like a barrier or a hurdle from the other side when you're trying to put your idea across?
Sure. No, of course, that's not something uncommon for me. I think for every project I have, there's always one person who's against with what I'm doing. My most recent one, I could talk about it, is here specifically in a lot of hospitals in the United States, they utilize electronic medical record systems, so EMR, and the most popular ones are Epic, and Epic has a portion in it called My Chart, where a patient can access their own medical history. They can reach out to the clinic that they visit. They can reach out to the doctors directly and respond to them and wait for a message. So one of the groups I'm working with is, they're really hesitant to accept my idea. So my idea is to have other forms of staff supporting the in basket messaging system, is what it's called, but they're not really keen to it because they're used to doing things their own way. So I had to get creative with my approach of outlining in my project proposal, saying, kind of going around loopholes, like, we could utilize the medical assistants in this setting only. We can make sure that they're and outlining in the project, like, these are their priorities in the clinic with daily patient contact, but it's really important we're having them actually be online and responding to messages as well, because that would improve productivity in the clinic, but it would also improve patient satisfaction and behavior. But that's not to say I'm still facing barriers, but that also, the creativity aspect comes in how you're pitching a project to, with what you're saying.
Yeah, that's exactly what I was trying to get at. That how you're
Yeah,
pitching a
sure.
project. So sometimes, somebody with perhaps better contacts or a better style of speaking, especially like better
Mhm.
contacts. Okay, let's talk about PR in this role, because creativity being able to be accepted, applied, and awarded in a lot of cases in the real world depends
Mhm.
on your personal relations or public relations,
Mhm.
uh,
Mhm.
which we also see in the art world, not just the healthcare world, but we also see that in the art world. That when somebody tapes a banana on the wall and they're already like a really celebrated creative artist. This is an
Right.
example that I've also given in a few previous episodes, but that's like the most recent example. That when they just tape a banana on the wall and they're
Mhm.
already a very celebrated or awarded artist, and they have this whole PR team behind them, it goes wild, right? Everyone's
Right.
talking about it. Everyone's saying, "Oh my God, this is so creative." But at the same time, if another artist who probably doesn't have that kind of team behind
Support.
them, where or
Yeah.
yeah, support or PR or whatever, they were to
Yeah.
put an abstract idea like that across to anyone, it probably
Yes.
not only won't be celebrated that much, but maybe on a lot of levels, it'll just be, it'll just not
Mhm.
be understood even. It
Right.
won't even get across to people. So, where do you think should we draw a line between what's gimmicky and what's creative? Number one. Number two, if you think that, okay, fine, no, the banana on the wall also deserves as much appreciation as any other
Mhm.
idea, then how do we bridge the gap between, celebrating all kinds of creativity, all kinds of creatives?
Of course. I think that's a really great question, and that really puts in perspective how something may seem so simple at what's in front of us, but we don't understand the intricate network underneath supporting something. So when I go back to, like, my work and what I do, it's very obvious sometimes when you're not having the champion support of your executives and the team that you're supporting, your idea is not going to get anywhere, unfortunately, because it's really how sometimes it's really the approach and how you're talking to people and communicating with them, not really your idea. So whereas you have good ideas, but the person supporting, whose idea it is, they're not the best communicator, not maybe they don't have the best approach on how to talk, right? So I think it's real. That's why for me, I really do try and push like design sessions or at least having a meeting or two to at least come together, because a lot of times it's just our own biases, right? Like not even biases about like race or skin color. It's just like, oh, they don't have as much experience as us, or they don't do the job we do, so they're never going to understand. So for me, really trying to go around the bat, I think it's really important to uplift any and all perspectives. So that's why I always try to push, hey, let's just have a chat with them. Let's just have a meeting, because sometimes when you're working the wheel, you're able to fill in a process map together and be like, oh, we do have a very similar theme here. It just had a few switches we had to make from XY to ZY, instead. So I think to answer your question, it's important we all work together at all times. And you really, a lot of times, once you start deferring the language, you really can work together and you can get that support from, let it be PR or marketing, or in my case, executives and nurses and doctors.
No, I think that's also like a really good thing that you highlighted, the role of executive in, being able to help you put your idea across. Because wherever we're
Hmm.
talking about commercial level creativity, whether it's healthcare, whether it's advertising,
Hmm.
whether it's even, production, stuff like that, it's always the executives who, can give you the green light for any idea, right? So,
Right, of
do you
course.
think, is there any solution that, executives can perhaps be trained, or their brains could be
Hmm.
put to a point where they're willing to accept, understand, and acknowledge all
Hmm.
kinds of creativity?
Of course. I I'm not here to say, of course, executives have gone to their spot because they hold a lot of experience, right? They're there for a reason. But I think it's really important to note that their mindset about certain ways and methods are really from their working career, and that could have been 10, 15 years ago. And we just discussed creativity can change with perspective, and a lot of that is with time, right? We have new technology, we have new processes, we have new social media apps, we have new ways of thinking, right? That they're always changing and cycling. So for me, I think it's really important for executives to really be one to one with not even just like the people under them, but really who they're in charge of supporting. Like they're at the top of the hierarchy, they got to make sure they're understanding who is at the bottom of that pyramid.
I
Two,
agree.
I think they always can, just because we have training and support for the 30,000 employees, I think it's really important that we have training and support for the 30 executives at top, because they also, it doesn't hurt to be refined in our skills in terms of knowing how to communicate and knowing new trends and visions that can be very positive for a company. So that's my perspective on an executive, and I hope that one day when I'm in that chair, that I'm working one to one with whoever I'm supporting, not just at a manager level, but really, I really want to be invested in the ground that I am on top of.
We hope so for that too.
Thanks.
Uh, okay, so again, I'm last question about the whole executive thing.
No,
So
you're fine.
we also, of course, acknowledge the experience of executives, and it takes a lot of experience to be there, to be on that chair.
No doubt.
But at the same time, because we just discussed that creativity is always evolving, it's always changing
Hmm.
with time. Uh,
Yes.
Yet at the same time, a lot of executives, any human being, I think, for that matter, who's worked a certain amount of years in their life, would be entitled and feel entitled to, be able to say the fact that no, we've done this, and this is what
Hmm.
works. But
Yes.
that's again then playing safe, because until and unless you don't really go into the unknown, you won't know what's there. You get what I mean? That's how,
I
the greatest things in the world were invented. It was somebody stepping into
Yes.
the unknown, stepping into
Yes.
things which weren't ever done before.
Of course.
Is there any way, like while communicating with executives, or executives in general, should practice to keep shifting their paradigm?
So it's very, like, for with me when I speak with executives, I just have a formula. I always bring the numbers to them, and a lot of times they don't. I get lucky that they don't question how I'm doing those numbers, or I hope to do those numbers. But that's what works for me. But of course, no two people are the same and no two executives are the same. I don't work with the all of the ones that we have. I only work with a couple. But in order to be evolving, right? I'm not going to sit here and say executives don't deserve to have the input that they do, but I feel like they really should value what people are bringing to the table, because you have one day these executives are going to retire, right? They need to have somebody to fill their shoes. And the only way that they can have somebody fill their shoes is someone who's willing to be evolving, because I'm sure those executives, when once they were in my position or any other position at my level, they also evolved something, and then they were used to doing that all the time. So I think it's really important that we're constantly accepting that new trends and new times will bring new perspectives, and someone will break the glass ceiling at every time something happens.
Cool, cool. Okay, and so now whenever we are to think of any idea, whenever we're to take any idea to any
Mm-hmm.
executives or in general, we're always
Sure.
told, and even during this podcast right now, you work in the healthcare system. People wouldn't really
Yes.
expect creativity to come into play while we're talking about the healthcare system, because we haven't been conditioned to think that way, right? We
No,
only
of
have one
course.
art class in school mostly, and that's
Yes.
just where we're told that, okay, here's where you need to be creative, and then
Mm-hmm.
chemistry and maths and everything else is supposed to be like just boring classes, although all
Yes.
of that has a lot of creativity into play too. uh,
Mm-hmm.
it's probably because we've been conditioned to think that creativity should look and feel like a certain way. Do you think that there is any way that we can break through that image or mold of creativity that we've made for ourselves and for people around?
Of course. I 100% think so. Even my own experience with creativity was always in art class, maybe, English class, where I had to write a very amazing creative story, right? But I really didn't even find out about the career I have until I just stumbled upon an internship listing while I was in college. And it was called process improvement intern. And I was like, that sounds really interesting. I wonder what it is. For this so-called team called Practice Solutions. And I thought, wow, that sounds like that's a really creative name. I just wonder what they're doing. So even just having such a name that stuck out to me, that really attracted me to the position, and then I was able to learn more, of course. But I really think it's important that we're showcasing to young adults, and not even but adolescents, that careers all over in every sector exist, that are really embedded in changing the ways that we do things and the ways that we run things, because of course we have our set ways of checking a patient into a clinic, but with technology evolving again, and with having new people come in all the time in our roles, there's always going to be something that could improve what we have. So for me, my biggest wish is that we are able to connect with youth, not just being like we and especially those who have a love for math and science. They always feel, oh, I'm stuck in this box, right? I'm in this box of numbers and formulas. But really being like, there is so much creativity beyond just that, because you can have careers in engineering, and you can have careers in project management and process improvement. Those really heavily rely on being a creative. May not just be the typical creative of like drawing and singing, but you're being creative with your mind and the ways that you are talking to people, the ways that you are doing design sessions, the way that you are formatting meetings and and flow maps.
True, true. And do you think that this problem can only be resolved if we were to go into the ground roots of it, and probably change the education system?
I think so 100%, only because a lot of times when we're thinking creativity and careers, right? People think a creative career, they're thinking dance, art, they're thinking fine arts. They're thinking in creative writing, which those are labeled creative for a reason, because you're always, of course, you have to think of how what steps you're going to use to choreograph a dance, what chord you're going to use to write a song. But I really do think it's important to show the versatility of creativity in your typical STEM classes as well, because for me, that's like the most way you can get and reach out to youths, because they're already collected in one area, right, at school. And that's where a lot of times you have the change in society happening, and more progressive ideas, especially in the US. Like typically college campuses and universities are very progressive and they're very open to new ideas. So I think it's important to highlight the versatility of creativity and careers.
True, true. And do you think it's like creativity, because we're talking about creativity and versatility in careers. Do you
Yes.
think it's more powerful, in fact, when applied in unexpected places, in places where, you otherwise wouldn't expect to be creative? For example, we spoke about math and science or healthcare.
Of course. I 100% agree because when it's unexpected, it's always kind of crazy to see people's reactions. I think one great example I have is even we have the tools of AI, right? And I'm not here to talk about the ethics of AI, but we've seen the creativity of AI and how it's been helpful for our doctors and our nurses because it's a really big problem here. We have healthcare burnout, we have a lot of patients, not enough providers, so we are able to use AI integration to fluster out for messages that patients are sending. So I think no one's ever thought about that. They've always thought, oh, human will run this, but I think there's ways to expand the use of technology, of course, as well, mixed in with it. But as long as you're being careful, I think there's a multitude of ways to encompass and always be changing.
Mm. Agreed, agreed. And okay, so you just brought AI up, and AI
Right.
versus creativity is a very big debate in the world right now.
Oh, yes.
Firstly, what's your stance? Is AI taking away from creativity, or is AI adding to human creativity?
I think it's a twofold question because I could 100% hear and say AI is abused and it shouldn't be used, but I can also see its benefit and impact because a human cannot just sit straight at 8 hours a day at a computer and just be trying to filter incoming patients. Like they have their own worries and concerns. Not everyone's able to go to the emergency room. They're not able to see their doctor. So I see the benefits of it in my area of career where of course it needs to, and again, I think the creativity aspect for me is a little different because I don't want it to impact human art. I don't want to impact music. I don't want to impact like where there's a lot of ownership involved, whereas for things like this, it's a tool that's being used creatively to assist and only better access to healthcare for patients. So I know it's a very non-answer answer, but I'm here to say that I can support it in the right places.
No, no, I can totally hear you, because I think from what I get, you're saying is that in places where, we really, really, really need the human touch, like for example, say music,
Hmm.
for example,
Yes.
say singing, dancing, stuff like that, their
Yes.
AI shouldn't really come into place, because those are
Correct.
very human experiences, and without that human touch, probably the
It'd
experience
lose
of it.
its
Yeah,
life.
yeah, yeah. Okay, but AI is also really being used in, designing things in art and stuff like that. Um,
Yes.
what do you have to say about that?
So for me, I'm not gonna say I so far my experience with AI, putting in whatever problem I've been facing at work, trying to see, it doesn't it doesn't give a clear cut way to do what I need to do because my work is so multi-step and it involves so much face-to-face interaction and involves so much going in multiple times. There's just no way that a AI tool, maybe the ones I'm using are not powerful enough, who knows, that I've experimented with. Not here to say that I did my work with them, but they just are not able to deliver what I'm looking for. So I don't think that they'll ever, I mean, who knows? I'm not someone who's sitting and creating the AI, but thus far, whatever they are churning out, it's not at a level that sh- is usable. And I really hope it never gets to that point because I think what really employs the work to be done that I do and that my teammates do, it's really just having that face-to-face interaction and having connections with people. That's something that doesn't happen with AI.
I agree, but at the same time, so AI is also taking the place of, influencers, of content creators. We're looking at things like Miss Rachel, for example. Yesterday, I was interviewing someone. She was telling me about this AI influencer called Miss Rachel, who teaches your kids math and whatever. and she also talks to your kids and stuff like that. So over there, AI is already probably, taking over classrooms and stuff like that. Do you think AI may take your job someday, or do you think that your job will always need that kind of human creative touch?
I think it will evolve with AI. I don't think, of course, I don't know tomorrow. Tomorrow's not promised, right? I think thus far our experience is, and what we've been given the nod to is we still need someone to input in the AI, because I'm just speaking, tenfold, but because the people in the clinic, like the doctors and nurses and support staff, like medical assistants, don't have the time to even think about solving a problem. So we need someone to do that work at least. So I'd like to think that I'll be around in some capacity.
Okay, I mean, everybody's hopeful about something, I guess.
Of course.
But okay, so what I'm trying to understand here is that you work in process improvement. Okay, now, for
Yes.
example, if tomorrow AI was able to sense whatever patients are coming into the clinic, etc., etc.,
Hmm.
uh, how much waste is being discarded, how much time is being wasted, etc., etc. Do you think still you would need a human being to put in that emotional quotient, perhaps?
I think so, only because when I do my work and when my teammates do our work, we really try to speak one to one with the nurses and the medical assistants in the clinic to really understand, we don't want to burn you out either. You guys have the human aspect, because you have AI that could diagnose. They use it now. They use it to diagnose diseases. They use it to create management plans, like, not in my experience, but I know it exists. But we still use the nurses and all that in our clinic. So I want having them, we still need someone to connect the two dots. Even if you have AI taking over, you still need someone to kind of manage the AI, right?
I agree with that. I agree with that. Okay, now Amal, coming out of AI, uh,
Sure.
tell us, how do you become like? Let's get back to the topic of creativity, because
Yes, yes.
you're always improving processes and stuff like that, and I'm sure you have to be really creative about that. So, how does Amal go into that creative zone?
Oh boy. Okay. So usually I like to get everything in one basket. So for me, I really have to start off with a conversation, because my mind works where I need to draw and write everything down. As much as I like to use technology, I'm a post-it notes and pencil kind of gal. So I sit and I map out everything that someone may be explaining. And then I go back and I'm looking. There's a system that we use in lean improvement, and it's called cause analysis. And it's constantly just asking, you have an issue, you just ask the question why. And the why should hopefully lead to another answer. For example, we have, it takes too long to room patients. You ask the question why. It takes too long to room patients because providers usually run behind. You ask the question why again. Why are providers running behind? Why? Because they start clinic late. Ding 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 ding. Why are they starting clinic late? Because they just start clinic late because they're coming late to work. So that asking those whys has gotten us down to the main problem, which is you don't have doctors starting their clinic on time. That leads to a whole clinic, all the patients running behind in total. So for me, I really do value just eh, just using my mind and having my ideas churn. Because for me, creativity really isn't being like, oh, like pencil and paper, like drawing something out. It's really just the mindset shift. And then that really leads us to conversations about, oh, we really need to be managing our time in clinic better, because then we are able to pinpoint the actual problem versus trying to go around and find a needle in a haystack. We know the specific problem, and then we can have a creative approach in how to communicate with, in this case, our doctors, on how to gentle parenting them, if you will, to start their clinic on time.
Cool, cool. So it's more about being in the moment and observing and catching on insights, from what I'm
Yes, that
getting.
is a lot of what I do. For most projects, I can say I spend between 80 to 100 hours of just observing the work, um, because we just need to document any possible way that things, if what is happening, and what's kind of the after effect of what had happened in the previous step.
And
And no two observations. Oh, sorry, I didn't mean to cut you off.
no, 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 no. I'm sorry for interjecting. Please
No, no,
continue.
you're good. I was just saying that, and no, and I what I think is also kind of hilarious is no observation is the same either. So that really leads us, like that really makes us think like every possible scenario too of how to improve the situation is what I was trying to say.
Okay. And do you think that there are any barriers that you face when you're, trying to apply that creativity or when you're trying to be creative? Because your process is unique from all the guests that we've interviewed as yet. So,
Oh yeah.
so
That's a good question.
are there any barriers that you face in, putting yourself in that mode, trying to apply that creativity, other than, of course, the executive problem?
No, that it can happen from the ground zero as well. You know, you are a strange face coming with strange ideas to a lot of people that are actually working in the clinic, working with patients. So you face some you can come up with the whole design plan and everything and have it ready to go to launch, but you really do need to have the buy-in from the people that are actually doing the work because they could just simply not do it. So you have to also be creative in the approach of how you're working with them because you have to let them understand you are here to support them and yes, you're answering to someone really high up, but at the end of the day, the change is only going to happen when we have people on the ground supporting it. So what can I do to make sure I have you guys involved in this and making sure that you're supporting it?
I see. And does that ever turn you off creatively, when you're not getting that kind of support?
Oh, 100% because we're all human, right? We all get frustrated when things are not working out for us, especially when it's your job, your livelihood. You don't want to face any barriers when it comes to launching things or when it comes to like simply coming up with a plan. Um, we're all human. So like they're frustrated about their job, I'm frustrated about my job. So it's a really, you have to be really humanistic and really try to have the buy-in from everywhere you go. Um, because without if you don't have supportive executive, you're not going to get anywhere. And you don't have support of your support staff, you're also not going to get anywhere.
I agree. And okay, so you guys are improving healthcare systems by being creative. At least you are, and that's what the ideology behind this whole platform. There is no alternative. Is also that
Yes.
Tina believes that the only way forward to a better world is by trying to find alternatives to things by being creative
Hmm.
because there's always a solution to anything. There's always an alternative to
Of
anything,
course.
just by being a tad bit creative. For example, in the healthcare system, just identifying that how much time is being wasted and trying to come up with solutions with regards to that. Do you think that in the real world, because you're already practicing this ideology in the real
Hmm.
world, do you think it's actually leading to any kind of breakthroughs, or like uh, is it just like this whole what would I say? It's just like this fancy thing that's existing right now, and it's not really leading to anything, or is it actually leading to anything on ground?
No, that's a good question actually, and that really does bring me to a point of being able to about being able to share and state that a lot of times for my job, I try and find other examples of other healthcare systems that might have done some innovative research and what are they doing to improve their scoring systems from patients? What are they doing to reduce provider burnout? Because I'm not the only one doing my job. There's 10 other people in the same shoe as me in a different company or with a different healthcare system. And like it all goes back to perspective and change, right? I'm only able to bring my perspective to the table to my system. So what did someone else bring to their system that I may be able to borrow and mirror? And I think that's a really great tool because a lot of for, I will say sometimes for my job, a lot of times it's just we attend lunch and learns to just see what's the industry standard. Is the industry standard evolving? Is the industry standard are we evolving from the industry standard where we tried something new? Um, and I think it's always a good thing because it's not really about for me it's not really about competition. It's really about making sure everyone has equitable access to healthcare. And if we have creative approaches to do that, then why not try it out?
Cool, cool. And okay, so right now, we're talking about healthcare system, but
Mhm.
before we wrap up, I also want to ask this that uh, in healthcare system, it's still probably a bit safer to be creative. I'm not saying it's 100% safe to be
No, no,
creative, because
yeah.
sometimes, of course, things can backfire. People may not like an idea. Things can
Hmm.
be taken out of context, etc., etc.
Sure.
But in other places, for example, when we're talking about creativity, and that's also one objective of Tina, to be able to create a safer creative world for everyone, to
Yep.
be their best creative selves, because everyone's creative in different ways, and that kind of creativity benefits the human race at large. So, and but despite that, we see a lot of backlash, not just in the healthcare sector, but in a lot of other sectors.
Of
When people are
course.
trying to be creative, the world is not safe for them.
No.
'Cause, either, if we're talking about cinema and art and literature, there's
Hmm.
censorship laws.
Of course.
If we're talking about healthcare systems, there are other kinds of laws, regulations
Hmm.
that direct
Of
the way the
course.
healthcare system operates.
Yes.
You can think of certain things and you can meddle with certain things, but you cannot meddle with certain things. Um,
Right.
so even if you were to come up with an idea, it can almost
There's
become blasphemous to the rest of the industry, because they'll be like, okay, how do you say this, because you're just not supposed to believe in it, or you're just not supposed to say
right.
this, right?
Right.
Then another very controversial aspect of being creative, especially in the healthcare sector, is animal testing, which is of course
All
very,
right.
very, 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 very grave, because
Yes.
all lives matter, and everyone bleeds the same color, whether it's a rat or a human being. uh,
Right.
so, how do we create a safer world for everyone, where everybody can be creative, but at the same time be able to make people understand that like, even if you're experimenting on a rat, the rat has feelings.
Hmm. I know this is a really heavy and loaded question, but I like this question because, yeah, we have rules and regulations about who can manage what type of symptom, we have rules about how a nurse can only give a certain amount of knowledge about, um, about a certain diagnosis, the rest the doctor will have to fill in. Like, we have regulations for everything. So, there's always, you could say the wrong thing because, you don't work in that field and you're like, oh, everyone's staring at me like, what's going on? But no, I really think it really does boil down to people have to be more empathetic to others and be willing to hear everybody out. Because I definitely agree. Your example about animal testing and being like we all bleed the same, right? A rat to a human. We all live in this earth. We all are trying to survive this earth. So why do we sit and make things harder for others, or why do we sit and make other people feel bad for doing things that, are not harming? Like, let's just say, I'm not here to I think it's really important that as long as we're being empathetic, as long as we're understanding and kind to everybody, we would make a lot more effort and changes in this world than right now when people are all kinds of racist, ageist, etc., right? Um, we really do have to understand and digest that we have to I think a lot of what's lacking is sometimes when people go hand in hand with creativity, they're thinking of people who usually have a little bit more empathy for others and who are not as ruthless. Whereas I think it's really incorrect to say that because creativity has no bounds. So why are we setting it up as a system where creatives can only have a certain look or a certain thought process?
See, that's all I'd say to that. And and about the animal testing thing, so that's also somebody being creative, but at the
Yep.
same time, how do we draw a boundary there, that the animal can also feel? So even if we're being creative, find an alternative to that, because I'm sure by being
Yes.
creative you can also find an alternative to animal testing, right? No
100%.
pig, no rat, no horse, no cat, no dog has to undergo any kind of weird drug after effects.
Yep.
How do
No.
you draw that boundary? How do you make the other person understand this, and while making sure that we have a safe creative world for everyone to be able to experiment, perhaps
Yeah.
the antidote to the next
Yeah.
big
No.
pandemic, but at the same time, we're not in the name of like some pandemic that may or may not come, we're not harming like a
Mhm.
thousand rabbits, or we're not harming like a thousand rats.
Yeah, no, I 100% agree, and I think it's also a good point of, like, animal testing is a creative thing that no one probably thought of before and decided to try it out, which I also am 100% against. I do wanna voice that. But I think it really goes back to my previous answer of most of the time, people, when they talk, that's just one example, but when you're talking about new prescription drugs and new type of surgical procedures, etc., you have to have a certain kind of ruthlessness in you to be able to do that and have that test and design process. I think that's why I never ended up in that area of healthcare, because I like to think of myself as someone who often feels pain of others a little bit too much. That's why I did not decide to become a doctor, but I still enjoyed helping people from a community level. Which I guess another answer to that is people say they also like in helping people at a community level. That's why they're doing the animal testing. But I really do. We need to see. I really think it's important to see that we live in a society where we know where things are barbaric and things have a boundary. So we do need to find an alternative. Let it be. We have the technology now. Why can't we just make up fake make not make up, make in a lab. We can make in a lab like human nerve endings, human kidneys, etc. We can duplicate those organs. Why must we do it on a live human animal that has sentient brain and thought versus a lab created organ?
I think that's a beautiful thought that you've given us to conclude on. Thank you so much for doing this,
Of
Amal.
course.
And we like this discussion was really insightful, especially from this whole healthcare perspective. And I think discussing this whole animal testing thing and you leaving us on the food for thought that, why don't we find
Oh,
an alternative to creating something that's not an animal and then test the drug or whatever on that?
yeah. Oh
Uh,
no, thank you so much for the compliment, and thank you for being such a great host.
This was Amal Amir in conversation with Tina Presents Creative Conjecture.